of them. I guess to give you the picture as to why on a population level, because today we're going to be spending a lot of time looking at the population level approach to body composition and why we care about it more for that rather than just for individuals. So this is in 1985. This is what the spread of obesity, so obesity being someone having a BMI of above 30 in America looked like. So this is 34 years ago. So 34 years ago, you can see that some states in particular, well, lots of them are white at this point, because until the mid-80s, no one really gave a shit because we didn't need to about this. Like, no one cared. Like, who cares how many people are obese, because it was so few. And then they got to the 80s and they're like, maybe a few more people are obese now than what they used to be. Maybe we should check that. So in 1985, which was mid-80s, was when the first surveys sort of coming out. Yeah, Appalachian in the Midwestern states here, West Virginia, for example, were starting to have about 10 to 14% obesity. Some of the southern states we had data for similar. Other ones were less than 10%, which was pretty good. Most of them didn't have any data though. This is just obesity, by the way. This doesn't include people who are overweight, so this doesn't include BMI 25 to 30. This is just 30 and above. And then if we go through year by year, you can see that at this point more states started to do more assessments, more state governments started to fund it. And as we go through year by year, you can see that we start to get more states that had a colour, but it was mostly, pretty good. Just some light blues, a couple of medium blues there, and we fill in. We get to 1990, which was the year I was born. Things are still okay, but you can see that some states which started with light blue, like Texas down here at the bottom, for example, started to realise they were having a growth in the number of people who were obese. Then once we get past 1990, we start to see a new category come up. So I was born in 1990, so feel free to blame me for that. We can see that some of these states down here in the south, so Louisiana and Mississippi, which are our two traditionally deep south most obesogenic states, started to see they had between 15 to 19%. Also up in, what do we got up there, Michigan, and in West Virginia as well, which is always battled in this case. And then you go through the 90s and you can see that pattern continues. Okay? As we go through, more states getting into that higher category, and we're getting a lot of states that are getting up towards 20%. Get to the mid-90s, and all throughout the Midwest, that obesogenic effect has started to increase. Then we get to 1997, the year the Crows won the premiership for the first time, and lots of you still weren't alive at this point, but we start to see that some states are starting to get a new category, so above 20% obese. Okay? So 1997. But then get to 1998, same thing sort of happening, and then we get to 1999 when you guys were mostly born. It really gets out of hand. Okay, we jump from a few states to a bunch that did another survey, so I blame you personally for this. That is the point, for those who were born in 1999, this is the effect you had on America. Well done. So we can see that at this point, probably the majority of states, particularly those emanating from the South and Midwest, have got over 20%. And that's where I think I got you guys up to on your slides. It gets worse. Okay, so when we get to the 2000s, we can see Colorado being the last bastion of a reasonable, so less than 10% obesity, kicking there, the nice square state. If you ever have to do a state project on an American state, do Colorado or Wyoming, because it's just a square, always easy to trace that on a map. And we can see that once we get to 2001, we see that Mississippi has now got above 25% people obese. So 1 in 4 people have a BMI of over 30 in 2001. As we continue to go through, we see West Virginia and Louisiana join the party, and then that spreads out 2004. And then in 2005, we see that some states, Louisiana, Mississippi, and West Virginia, are up above 30%. Okay, new colours coming in here all the time, above 30% obese. This doesn't include those, because another 30% of the population would be between 25 and 30. So that means that if you put it all together, you'd have over 60% if we put overweight people in there as well, who are above a healthy weight category. Guess what? Keeps getting worse, spreads more and more and more. Now lots of states are above 30%. And when we get to 2012, we see another new colour come up there. We've got above 35% obesity in a number of states, and that continues to grow and grow and grow. This is the last figures they've got updated. Colorado and Hawaii still holding on to only around 20%. Everyone else above 25% obesity in those states. with West Virginia, which is currently the leader. West Virginia and Mississippi are the two states that have traditionally battled it out for the fattest state in America, currently sitting at about 38% obesity. What the fuck is going on? 38% obese, add in there the fact that you've probably got another 30 to 40% that are overweight, you've got 70-odd% people in those states are above a healthy weight range. And this isn't something that's happened over 200 years, this has happened in 30 years. But this is a new thing. People are like, oh, we've been, it's not that sudden, it's not like our diets have turned to shit all of a sudden. Yeah, they have. It's 30 years. And we've gone from most people being in a healthy weight category to this debacle. So it's a problem. So from a population perspective, you can see that this is why we do body composition assessment. Because this is a really important thing for us to know. Because if we're trying to improve health over the lifespan, this is something that is impeding that, okay? We are in what is called, people say it's an obesity epidemic. Well, it is. Look at the spread, okay? If that's not an epidemic, I don't know what is, okay? We are in an obesogenic society now, where it is easier to be obese than it is to not be obese. And that's the world we live in. So that's why we care about it from a large population perspective. Now, that doesn't mean we're getting everyone in America and putting them in an underwater weighing tank. There are other ways we can do it that are still telling us about body composition, but it is an important thing for us to pay attention to. So, when we look at body composition with the actual assessment from a technical